Hey, welcome to Thinking Green. I'm Rana, and I'm joined today by a couple of friends whom I know from other kinds of medical healthcare advocacy. Dr. Phil Brewer and Dr. Liza Goldman Huertas, who I know from other healthcare groups. But tonight we're going to be talking about a new organization, New Haven Health Workers for Palestine, and their involvement in that. So, welcome, Phil. Welcome, Lisa. And I guess we can start by each of you just talking a little bit briefly about what motivated you to become physicians and a little bit about what medical practice and experiences you've had, that way, and your advocacy for, healthcare for all.
So I'm a family physician, and most recently a breastfeeding medicine specialist. It's a new field. I work in Hamden. Um, I attended Yale University School of Medicine, and worked my first job as a primary care provider close by in Fairhaven. I would say that my commitment to healthcare for all people and to human rights and solidarity work far predates, but comes from a similar motivation. And I just wanted to also make sure that I mentioned that I'm a member of Jewish Voice for Peace, and there are new organizations forming for doctors that are advocating against the war on Gaza right now. Organizations like Doctors Against Genocide, and local groups like Connecticut Palestine Alliance. So I guess I should also say, so I knew that I wanted to be a primary care physician from early on. And I think that is a lot because, well, everyone is different about what within the profession, what they're, most drawn to and what they're best at. But for me, primary care, just in general, seems to be one of the more sort of fundamental pieces of healthcare. So there's almost no area of health outcomes that aren't affected by primary care. So it seemed like a particularly impactful place within medicine. And then later on, I've also been really focused on care for the underserved. It's been incredibly meaningful to be a primary care provider. I've also since taken what I thought was going to be a short detour to bring more of this knowledge back into primary care, but into a deeper dive into the maternal and child health by way of a very new specialty in breastfeeding medicine, which probably should not be a new specialty because breastfeeding is so fundamental to our physiology as human beings. But I think that this orientation towards prevention and towards maximizing health outcomes makes it a natural place. It's a natural place from which to respond to healthcare systems not meeting their stated goals, and equally our American policy not meeting stated goals of upholding human rights and health outcomes.
Okay, Phil.
Thanks for having us and for this opportunity. So I'm a recently retired emergency physician. I spent the bulk of my career at Yale as one of the founding faculty in emergency medicine, starting in '88. Prior to that, in fact, prior to medical school, as a pre-med student, I had the wonderful opportunity of being mentored by Dr. Quentin Young. Dr. Young was one of the founders of Physicians for a National Healthcare Plan, and was the chief of internal medicine at Cook County Hospital for 9 years, and ran a program called the Urban Preceptorship that I was accepted into and spent a summer and got radicalized about healthcare and about what's horrible about our for-profit healthcare system, I've stayed on that path ever since. And that path is parallel to other issues of social justice and the evils of colonialist traditions that we have, et cetera, and I think goes hand in hand with um, my participation in opposition to what's happening and what has been happening in Palestine for the last 70 years. Um, so, uh, emergency medicine, maybe for the opposite reason that Lisa is in primary care. We sort of need both ends. And I worked as a college student, I worked part-time as an ER tech in the local hospital. And so that sort of set me on my attraction to that sort of that part of medicine. Um, and gave me a window on our healthcare system because what I did, I would say three-fourths or more of the things that I did as a physician in emergency medicine, including at a level one trauma center, about three-fourths or more of what I did actually should have been done in a primary care office. But because of our healthcare system, people end up being forced to come to me for what should be their primary care. And um, so that's sort of me in a nutshell.
Now, you mentioned that, this has been going on in Palestine for 70 plus years. And, when those of us who have tried to get not-for-profit universal health care here have pointed to the fact that Israel did have universal health care, but they didn't have access to for everyone. And in the territories, the occupied areas, the access to health care was very inequitable even before October 7th. But maybe the two of you can talk a little bit about the current conditions in Gaza, in East Jerusalem, in the West Bank, maybe in southern Lebanon. It seems as though members of the medical profession have really, I don't know, related or been, ignited by what's happened. And, some of the stats might give some of the reasons why.
Well, I feel personally offended by the fact that um, one of the most important things that has happened since October 7th has been an intentional annihilation of the entire healthcare system in Gaza. It's not by accident. It's not because every hospital is sitting above a Hamas control and command center. It's because they don't want people in Gaza to have access to healthcare. And to me, the idea of having soldiers come into a hospital where doctors and nurses and other health personnel are trying their best to take care of patients and putting them in handcuffs and whisking them away to the desert, to a desert military base, and torturing them and abusing them, um, to me is a personal affront as a physician, um, aside from all the other issues. And it's pretty clear why this is being done. And I, 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 I think the approach that the UN is taking in considering this to be one of the war crimes that's happening is very important. Uh, but equally as important is the fact that our government opposes accountability for these crimes. So this is a very tough time to be an American and to be an American doctor for those reasons, but nowhere near as tough as being a Palestinian doctor.
Well, I had heard the news on October 8th, and the first place really that the IDF targeted was Al Shifa Hospital in Gaza City. And, um, and one of them was a neonatal, ward, which seemed especially awful. So, yes, I also think it's pretty clear this is a war crime. It's, considered a war crime to collectively punish. And if anyone is going to be innocent of what people in their neighborhood might or might not have done, it's a newborn. Um, but one of the things I had also seen about the healthcare system now, and maybe we want to talk a little bit about this, is I mean, it isn't just one hospital. There really are no fully functioning hospitals in the whole Gaza Strip now.
Yeah.
Maybe it would be a good time to review, the vast effects of what has happened since October 7th in Gaza. Um, I think it's important to have an accounting, basically, of the small portion of the health impacts that people have been dealing with. I don't know if we can.
Yeah, we can share the screen and tell me if this is the right one. No, actually, that's the attack on healthcare. Would you like
Yep.
this one or the other one?
Well, can we start with the general one, and then,
Okay.
I think we should move to
Okay, I
the.
will stop sharing this one and share the other one. Um,
So I've been very amazed by how poorly the media covers what the civilian health consequences of this war have been. Um, there has been, peer-reviewed. There've been peer-reviewed articles that have, assessed the information that we have about fatalities and injuries, and these are definitely underestimates of what has happened. So more than 35,000 people have been killed, far more. 83,000 people have been seriously injured. And this is definitely an undercount because there's likely thousands under the rubble. Only people who can be identified, basically, have been among the count of fatalities. And children are an enormous portion of these fatalities. So there's been systematic violence, and there's been a failure both to, really put a weight to the devastation in terms of murder of civilians in Gaza, murder, killings, and injuries, but also to name, Israel and the IDF as being responsible, and indirectly or more directly even the US for supporting this monetarily and materially with bombs. People have been killed by bombs, guns, just immediately in that way. And I can remember, we were talking about hospitals. I can remember very early on, one of the earliest attacks on a hospital. I experienced it in much the way that was like the MSF, Doctors Without Borders, had a hospital that was targeted in a different conflict. I believe in Afghanistan. I'm not sure, but I remember feeling so appalled, and feeling that surely this would get the world to stop what was happening. It's such a clearly defined war crime to target hospitals and healthcare workers, and in such a spectacular way. So this is early on. So this is not a recent phenomenon, but it has continued. It has been continuous. And so our colleagues who have had to work in conditions that none of us here can imagine have additionally feared for their lives almost continuously as they're trying to do the impossible and treat wounded people without all kinds of basic life-saving equipment, basic without fuel, without medications, so performing surgeries without anesthetics, things like this, while they're also fearing bombing, direct bombing of hospitals, assaults on the hospitals. Some of our colleagues have been many now. I think we have those figures in a different in a different slide. Have been detained, tortured, and have reported on their torture. Has testified as to their torture. So it has been an unbelievable attack on healthcare workers. So for those of us who have been, as healthcare workers, paying attention to our counterparts, our colleagues, our people who we've become, more close with, even if we weren't formerly, close. It's been very traumatic to see just what horrific conditions they've had to work under, and what threats to their lives and their families.
You mentioned MSF also. I kind of recall that in Gaza as well, MSF at one point was talking about how they had lost communication with all of their physicians in Gaza, and they had no idea, where they were, whether they were dead or alive. And at some point they had, I think, pulled people out. I think they're back, but the communication out of Gaza, especially in that first month or so, it was just all blacked out. There was no idea what was happening.
Yeah, there's been so many interrelated violations of international human law in this situation. I feel like our profession in general is slow to take on any kind of position that seems at all political. Everyone is trying to maintain neutrality. But in this situation, you cannot, basically, it's sort of a war on healthcare. So, it can be described as a war on children and civilians. It can be described as a war on healthcare. And so people have been inspired from all different walks of life across countries and healthcare professions to be in solidarity, both with healthcare workers on the ground, Gazan healthcare workers, and also just to even go there themselves, physically be present and relieve and support, or just not even relieve, like replace, because there's so many healthcare workers who've been lost. And the circumstances are such that it's incredibly difficult to meaningfully perform healthcare. I don't know if Dr. Brewer would agree. Some of these situations. So I think we have a healthcare worker. We have sets of ethics and sort of goals that we keep in mind. So sometimes, in some situations, we try to cure. We try to relieve pain and suffering. We try to prevent. And when all of those things are gone, we try to comfort. And I think that in many situations, that's also been the role of healthcare workers, to provide some semblance of safety and comfort. But even those functions are hang by a thread in this situation.
It's hard to consider it to be comforting when you're amputating a child's arm with no anesthesia. And that's just one of the 1,000 crimes that is being committed. And the reason for the no anesthesia is that anesthetic supplies is one of the forbidden items when the few trucks who do manage to find their way across the border into Gaza are inspected. They remove anesthesia products, as well as a host of other things that have no military value. And this is, again, part of intentionally making life as miserable as possible for the entire population and increasing as much as possible the risk of not even being alive anymore. If you look at the totality of the picture, the starvation or malnutrition, the breakdown in the sanitation system leading to widespread diarrheal illness, which causes extreme dehydration in a place where there is no clean water to drink. And certainly, aside from whether it's clean or not, there's not much of it. The physical trauma that people are exposed to, um, the annihilation of the healthcare system, the complications of childbirth and pregnancy, the psychiatric and psychological impact, the shut off of communications, literally and figuratively keeping people in the dark, unable to see at night and unable to communicate through their cell phones. The result of that is uh, a what I think will turn out to be, once it's documented, an astounding increase in the number of excess deaths. And for people who aren't familiar with that term of excess deaths, it's a public health term that is used to identify something happening. So, for instance, during the COVID pandemic, um, over a set period of time in a population, say New York City or the state of California, there's a fairly steady number of deaths every week from week to week. And if that number spikes, there's something causing it. And so during the pandemic, we didn't have to prove that it was COVID causing those increased deaths. We could assume that that was the case and later on go back and prove it. And so this number of 36,000 deaths, those are people in which the bodies have been brought to a hospital and identified. Okay. Well, first of all, there aren't any hospitals left. I mean, there are, but the ability to transport a dead person to a hospital has gone down. So that number is a fraction of the number of excess deaths, which I think is going to turn out to be 100, 150, 200,000 people who died who otherwise would not have died. Right now, if you're in Gaza and you get appendicitis, you're going to die from that. There's no reason for anybody to die of appendicitis, but you now have a condition that normally can easily be taken care of by the medical system, but there is no functioning medical system, so you're going to die. You're just as dead from appendicitis that wasn't treated as you are from a bullet, a sniper's bullet to your head, or a bomb that blows up the building that you're in. Um, so I would like to have more emphasis on the idea of excess deaths and less on the body count from explosions and bullets and so forth, because that's the true picture of what's happening. And as far as I'm concerned, and I'm not alone in this is all part of a 70-year campaign of ethnic cleansing. And um, one thing I meant to mention in my self-introduction was one of the major influences on my view of the Middle East and of Israel is a book by an Israeli historian named Ilan Pappé, and the title of the book is The Ethnic Cleansing of Palestine. And the plans to ethnically cleanse Palestine, meaning the plans to expel all of the Palestinians from, and I mean all of the Palestinians from Palestine, those plans were formulated in the early 1930s, not after the Holocaust, in the early 1930s. That always was the plan, and it's still the plan. And I think what we're seeing in Gaza is a continuation in a very brutal fashion of that plan.
Do you think it's really hard for those of us in the US that just assume that if we have to go into the hospital, there will be a level of cleanliness, of sterility in the operating room, that you'll get anesthesia, anesthetics, you'll get painkillers, you'll get antibiotics. And is it beyond people's imagination here to really think that not only like it's somewhere sort of far away, but it's a U.S. ally, and our government is actually funding this activity to a great extent. Can people not grasp it, or I don't know, is something else going on?
I think it's probably very easy to grasp if you work in a slaughterhouse. And that's the only way it's easy to grasp because that's what it looks like. It's you better be very good at crouching and stooping if you're a doctor or nurse in Gaza because almost all the patients you're taking care of are lying directly on the floor, directly in blood from their own blood and blood from previous patients. That's the situation. It's atrocious.
I think that um, it's very difficult to completely accept the reality of what is going on. I wanted us to make sure we started from there, from the, easily verifiable, obvious to most people, casualties, injuries, and the state of the healthcare system that is, you know, can I guess I can't say it was a purpose. I can't say that that on October 8th they had a plan to destroy X number of hospitals, kill X number of healthcare workers, um, deprive the entire system of, but um, it's a conversation about impact and intent. You don't necessarily have to have a full intent discussion to talk about the impact. Um, and the conversation I'm referencing is here in the United States when we talk about racism and health disparities. Um, so many of us are really aware that the kinds of healthcare that someone can access are conditioned on geography, like where you live, what your socioeconomic status is, what your insurance is, many things like this. And so the issue of what's happening in Gaza is connected. It's just so far, so extreme from the daily experience of Americans that it can be hard to grasp to fully paint the picture of what people are facing in terms of healthcare. But I think that it is also important to talk about that health is not just, will there be someone to stop the bleeding when you have a horrible wound? But the health is a state of complete physical, mental, and social well-being. And it's not merely the absence of disease or infirmity or death. I think it's hard for a lot of us who want to be talking about optimizing health to talk about stopping extreme high levels of dying.
Mm.
But they are connected. So there's been a move within medicine both to address health disparities because they lead to excess death. But also, I'm trying to find the right words. There are deep connections between what is happening in Gaza and what is happening here. Sometimes those connections are not obvious, but health disparities is one way to look at it. So over in Gaza and in Palestine, they're dealing mostly with occupation, war crimes, apartheid. But here in the United States, we have other legacies, and we may not have explicit military occupation, although we also do have we do have colonies within the United States. I'm from Puerto Rico, which is a colony of the United States, and so we do really also need to talk about the fact that you don't just kill people with bombs and guns, but by depriving them of food and water. And I agree that those could be those could be some of the biggest effects. But there's no category in Gaza where people have an adequate level of human right to health and protection for healthcare workers. The magnitude of the violations of human rights is just really, really staggering. And I think that as healthcare workers, it's particularly important on both on the level of we're supposed to center the needs and the health and survival, just what we're talking about, survival of human beings. But I lose myself. I have to say, I lose myself in figuring out what to do first. Because we may, but you know what, it has been clarified. So there's people who see that there are injured people, healthcare workers, physicians, and they say, well, I'm going to go and I'm going to relieve some of the healthcare workers. I'm going to try to, help take care of some of those patients. But what happens to them? They fear for their lives. They get stuck there. They can't leave. They can't be relieved. There's almost nothing that you can do without. Everyone should try to participate and help whatever means that they can. But until there's a ceasefire, it's very difficult to ensure that humanitarian aid can arrive, that people can get food, water, basic medical supplies or medications, that healthcare workers and humanitarian aid workers can replace other humanitarian aid workers. So I think that healthcare workers have a very potential radicalizing role in this situation, which is we have an ethic of caring, and it's being completely violated. Not only by the targeting of other healthcare workers, by the destruction, the mass destruction of everything that sustains life, but not even allowing healthcare workers any level of safety and in trying to act in solidarity. And so I think that even though as a profession, physicians especially, I'll say more within physicians, we tend to be more conservative, and conservative in the sense of just maintaining a status quo. Like the status quo, for us includes our institutions that do certain functions that we value very highly. So a hospital taking care of people, or medical school teaching students. So we want to maintain things as they are in that sense. But we cannot, there cannot be a continuation of business as usual when things of this magnitude are happening, when such violations of the core ethics of our profession are happening. And that's why I've been really pleasantly surprised to see that, some, despite the overall conservatism within the profession, there are many voices, many people who are really trying to act in solidarity and explicitly ask for a ceasefire, which should not be a radical call. Really should not. Early on, I called friends that I had in Palestine, not called, but reached out via Messenger, and asked them, I want, so tell me what can I do from where I am, work for a ceasefire. They could have asked for any number of specific things, but ceasefire was the first precondition for anything else, an immediate and permanent ceasefire.
Yeah, we're not talking about a 2-week pause here. One of the disturbing developments that's gotten worse over the last month or so, though, is increasing, well, we've had censorship, which makes it very hard for the general public to get all the information, but people are speaking out and are being harassed and targeted for speaking out, including Jewish protesters, including healthcare protesters. I think, Lisa, you had shared with some groups that you have colleagues, both in the US and in Canada, who are being targeted with terrible consequences and harassed for speaking out on this subject. So and on college campuses, the demonstrations have in some places been peaceful, and in some places they don't quite evoke Kent State yet, but it doesn't seem that far away. The policing in some places has been, totally inappropriate to what the actions have been. So what can we do about that piece of it also, that it seems to be for many people, even liberals, an area that protest is not allowed?
So I am in a lot of sort of a women physicians social media groups, and I was incredibly surprised by how extreme the censorship has been. So I'm Jewish, I'm Puerto Rican. It's been, I say, 20 years that I identify as anti-Zionist. And what that means to me is that I oppose occupation and apartheid in Israel and Palestine. And I support democracy and self-determination and human rights there. I am not Israeli and I am not Palestinian. And so I don't have a whole program for how that occurs, but I try to support efforts in those areas. And I knew that, mine was not a common opinion, but, it was just completely not allowed. So within a few weeks, I was in a group of physician mothers, and I won't name the specific name of the group, but I saw that there were many Palestinian, Arab, and Muslim physician mothers who voiced opposition to the killing of civilians. And how could that be a controversial point in a physician group, a physician mother group? And they were excluded for the point of specifically opposing Zionism. So instead of anti-Semitism being one set of definitions, it included opposition to Zionism. And eventually, I could not be silent any longer. I said I needed to speak out in this group and say, this is racist and Islamophobic to exclude people based on their political beliefs, or not even a political belief, just a belief that human lives are sacred. And before I was able to do that, they finally got to me. I think they tolerated my speech longer because I was Jewish, but they got to me. And in impact in this group, it was overwhelmingly, women of color, Arab women, Muslim women, Palestinian women who were excluded. And, there wasn't time for a reckoning with that because several of us just formed a group to, act in solidarity with the people of Gaza. I think at another time in my life, I would have been really focused on addressing that level of censorship. But this is a very small thing compared to what my colleagues have been facing. So people have faced doxing, revealing of their personal information when they've expressed support for not killing civilians in Gaza. Recently, there was a nurse, and there's going to be a rally in a protest at NYU about a nurse who works in maternity, works with mothers, and she worked with bereaved mothers, and she was at a ceremony, award ceremony. She received an award for her work with grieving mothers, and she mentioned the word genocide. She mentioned she connected her work with grieving mothers to things that were taught to her by her family, and expressed sorrow about genocide in Gaza. And after receiving her award, she was terminated. And it wasn't just what she said, but prior to that, she had been targeted. She had been told that she couldn't share things on social media. So she absolutely said nothing at her workplace, but in social media, and they had already targeted her for that. And despite winning an award, she was immediately terminated. So there's work going on there.
I
Another
believe she was Palestinian. Is that right?
Palestinian,
Yeah,
yes,
yeah.
Palestinian. And so this is clearly racist, Islamophobic. This has been, I will say, I'm Jewish, and I have had this sense of believing in Palestinian rights being just as important as human rights of people of all religions and ethnicities in the Holy Land for a long time. Um, but it's been a time where I've really come to understand how deadly racism and Islamophobia is, both in Gaza and here in the United States, how pervasive. I had not really understood how important it was for me to understand it and to speak up against it until I feel like really until this year. I'm really sorry to say that. I'm not proud that I didn't understand in a visceral way how dangerous anti-Arab, anti-Palestinian racism is, and Islamophobia. One of my friends has a friend who is the mom of Hisham Artawani. He was a Palestinian student at Brown who was walking with his friends in Vermont and was shot by someone while they were wearing keffiyeh, which is the Palestinian uh, scarf, and speaking in Arabic with a friend, and he was shot in the back and is paralyzed. So that happened, and then it's during that time that I was going out to the street to protest. And I have to say that while people were talking about anti-Semitism, my greatest fear and my reason that I initially did not bring my children was I was afraid of a white supremacist targeting us because of the Islamophobia that is so prevalent in our society. So I think that even if you are a person who does not feel comfortable understanding history or politics or foreign affairs, you can always just side with not killing civilians and not causing excess deaths among civilians and not and being against racism and Islamophobia here.
I think, well, we only have about 5 or 10 minutes left, and we wanted to definitely get people aware of different ways to be supportive of the effort on, different levels. Do you want to talk a little bit about the different organizations that people can access to support and be supported by?
I want to just say the importance of joining a group. A family member, in response to a Facebook post that I put up, said, "Well, what can I do? How can I help?" And I said, "Join a group," because as individuals, we have tiny, tiny, tiny bits of power. As groups, we have a lot more power, and so there are um, there are a number of groups. I myself have been a member of Jewish Voice for Peace for the last 8 years, even though I'm not Jewish. Um, and I'm also a member of Healthcare Workers for Palestine. That's more recent. Uh, there are a number of groups that can fit your personal religious background or political leanings or whatever, but become part of a group, and they will find things for you to do to fight against this atrocity, and not just what's happening right now, but the overall problem of occupation and denial, endless denial of the human rights of people who happen to be Palestinian.
Are there any other groups we should be mentioning? And I think at the end, before we post this show, we'll put a list of different groups and their at least website or contact info so that people will have some idea of where they can look. And I think about, also economic actions. the group Israeli Committee Against House Demolitions, which I've supported for about 20 years. For a long time, their motto has been BDS for BDS, boycott, divest, sanction for a binational democratic state. And I have to say, when I was in Israel, 50 years ago, one thing that was true then was that there were no walls. It was that funny time between the Six-Day War and the Yom Kippur War that I don't know about Gaza, but the West Bank was not at all walled off, and you could just drive everywhere. And you kind of got a sense of what a single country might look like. Well, anyway, that all went sideways. But it's still maybe the only way that's, to forge forward, perhaps taking South Africa's lead and having a Truth and Reconciliation Commission, because the apartheid policies were going on way before the genocide and the all-out, ethnic cleansing. So there are, and political actions, I've seen, and I will get slightly political. I've seen campaigns to abandon Biden, and people in Connecticut feeling the same way about Chris Murphy. And my question, of course, was like, so what do you do? 11% of the Democratic voters in the last primary voted uncommitted. But uncommitted doesn't put anyone in office or make a very clear statement. So, I did want to mention there are candidates that are running who are anti-genocide. Both Jill Stein, who also is a physician who went into politics because there were problems that couldn't be solved in the doctor's office, and went a totally different direction. And Dr. Cornel West are both petitioning to try to get on the Connecticut ballot. Socialist candidate Claudia de la Cruz is not trying to get on the Connecticut ballot. But I think it's a good idea to get as many of these voices into the discussion leading up to the election, because I think the media and the major parties are trying to make this a side issue. And it isn't a side issue for us, especially when we're providing much of the funding and the weaponry.
Yeah, I want to add something to what I said before. It's very important for us here in the United States and around the world, but particularly the United States, to be doing what we can do. We as individuals and as groups actually have much more power than anybody in Gaza, because it's our government that is enabling what the Israeli government is doing. And if you're a Gazan fleeing the bombs and moving to the new safe zone, you have no power to change what's happening except to survive. What we have here is the power to alter the course of our government, and we've done that. Not in any great way, but we have done that, and we have to just keep putting on the pressure and fighting that. I think Liza would agree with me that our friends and acquaintances in Palestine tell us exactly that. They're looking. They're looking at what we're doing.
This takes me back to that definition of health. So one of the things you learn early on in medical school is to make a progress note, objective assessment plan. So hopefully we've talked about a lot of objective things of the facts, our assessment. We've mentioned the word genocide. There's scholars, genocide scholars who put out their concern back in November. But the words that we use to call this might not be as important as the fact that so many people are being killed. And so I would encourage everyone to have a low bar to see the facts of what's happening and decide to take a side. And the sides are not the way that they're drawn in the media. The sides are civilians against militarist, very short-sighted governments that are destroying everything in Gaza, and are escalating their violence in the West Bank. and in East Jerusalem. I think that because this is a unique time to take a personal inventory. So because of the level of crimes that are occurring, we need to think, how am I personally related? So one of the things is that we are citizens of one of the wealthiest countries in the world, one of the most militarized countries in the world, a country that is directly materially contributing, may even be contributing personnel, in addition to the political cover, to what is happening over there. So so any opportunity we have to raise our voices to our elected officials, and that includes, absolutely our representatives, our Congress people and our senators and the president and any relevant federal offices. But we should reach for wherever we have a unique voice, a unique amount of power or ability. So that includes, we should probably be doing more within our medical societies. There are some medical organizations that have spoken for a ceasefire. We've had difficulty with many other organizations. I've been extremely frustrated by, there's some cities and towns that have passed ceasefire resolutions. Ceasefire is very important right now in the moment. Ceasefire, stopping more weapons from being shipped over to Israel. But the other goals are very important too, which is reestablishing humanitarian aid and material support and assistance to people attempting to survive this, what many of us think is genocide. There's just a limitless number of ways that people can participate. And I wanted to mention, like, for people who are in different stages of this. So for people who are very new to the situation, I would encourage you, if you have access to Instagram specifically or TikTok, to follow some of the Palestinian journalists who remain. They've also suffered enormous casualties. There's been so many targeted journalists, but there are many. For me personally, I found it very helpful to follow Bizan Auda, who recently won a Peabody Award for her journalism during this time. And she often opens with, it's day 340, I think now, 340 something of this genocide, and I'm still alive. And then, she goes on to report. There was something about how she did that for me led to personally deciding, well, it was 109, day 109. And I said, well, I'm going to come up with 109 actions that I can take, to honor the enormity of the atrocities of 109 days of this. And I feel like that is, the enormity of this makes it so that sometimes it can be intimidating to get involved, but it's as simple as, making a phone call. It's as simple as, taking up, finding out about the boycotting actions that you can take. And I do want to highlight, as Dr. Brewer was saying, joining a group, being a joiner. And so if you're a healthcare worker, there's a healthcare worker for Palestine, local Haven, health workers for Palestine in New Haven. I've found really, really helpful to be involved in the healthcare workers for Palestine in New York. There's a Doctors Against Genocide group. Jewish Voice for Peace has a health action group within it that does updates on the health situation. And within Connecticut, the Connecticut Palestine Alliance, Connecticut Palestine Alliance, there's also Connecticut Palestinian Solidarity Coalition. And in local towns, there are ceasefire groups. I encourage people to explore what ways that they personally are both related to this and most effective. I think at some point I would love to see more of us in the Jewish community address institutions, Jewish institutions as well. See. Yeah, I think those are some of the main ways that people can take action is by joining groups, joining dedicated efforts. Oh, I should say that it's been really important for me to be involved in the CARE. It's like a Council on American Islamic Relations, the Connecticut chapter. They have WhatsApp groups, and they help you figure out sort of like what are the political actions that are helpful. They have a Muslims and Friends, basically, solidarity group. And I mentioned that because I think a lot of people are just, at a loss because of the enormity of this. I also just really wanted to say that ceasefire is the sort of the minimum that we need. I hope that so many people who join the movement maintain their commitment to ending occupation and apartheid, because these were sort of the preconditions for the horror that we are seeing now. I have to say, I could never in a million years have imagined how violent and vicious these past 8 months have been. If we were paying attention, we knew that healthcare workers were targeted, like ambulance workers, paramedics, in Gaza and in the West Bank. So that shouldn't have been a surprise. But it just shows how if you allow racism and colonialism, if you do not speak up against it, you may live to see some of the horrors that we're seeing now.
Well, thank you, Lisa. Thank you, Phil. And just for anyone who's viewing this, who's interested in next week, the guests will be Jennifer Muggio and Frida Berrigan, who will be talking about the Place for Community Wellbeing in New London, which is a collaborative effort among Ledgelight Health District, the Southeastern Connecticut Community Land Trust, and the Food to the People program. So we'll see you then. And thanks to both of you.